Okay, thanks very much for inviting me to talk today on St. Patrick's Day, so it's quite a big day here. Okay, given we've got a small group at the moment, I'm happy if this works in this format for people to ask questions as we go. The initial part of this presentation is focused on some of the core statistical findings and gives you a bit of an overview. I don't so much expect there'll be a lot of questions on those sorts of things, but feel free if there are. Equally, there are some other issues that will move on that might be points for discussion that people might want to raise. And when people ask a question, if people could just introduce themselves briefly, that might just be helpful for us to know people. Okay, thanks very much. Now, just some little background information on adults who were sexually abused in childhood. There's pretty strong evidence across the literature, and it's not really a surprising thing that when we look at populations like people who are in receipt of mental health services, people who have a mental health diagnosis, people who have been sexually abused in childhood are overly represented in those groups. There's also some different information about men, and perhaps the story about men is still unfolding in terms of what the particular effects are. And this is really important to understand, in that whilst there's lots of similarities between men and women in terms of the response to trauma, it stands to reason that gender and socialization and masculinity do shape how men experience different effects. And one example of that is that suicidality is a particular issue for men across the whole population of men. We know that men harm themselves and commit suicide at a much higher rate than women. So that's one area that, in terms of the research, that I think makes this issue of child sexual abuse, both on a mental health and effects, a real public health issue. The other thing that's fairly well established about men that I believe, relates to masculinity and the construction around men's ability to ask for help is men disclose at a much lower rate at the time the abuse occurs than boys I should say, disclose at a much lower rate. And subsequently, men take much longer to discuss their experience or to come forward to seek help. And often this experience is often very much centered around feeling that they'll be judged in some way, some negative way, if they make a disclosure later in life. And there's a whole range of factors that might influence that. Often the men that practitioners see that access services, they've been coping on their own for a long time, and perhaps have had contact with professionals but haven't been able to really trust professionals with regard to a disclosure about what might sit behind some of the effects they're experiencing. But what I'm really interested in is that these men that cope for a long time on their own and through other mechanisms, perhaps not seeking professional support, they're a really interesting group because they live lives that might, on the face, it seem very functional and very active, but often these same men talk about the ongoing trauma and the daily feeling of, and effects of the abuse. So what's really important is looking at how men cope, how that might influence how we respond to men in intervention, and how that message might be used for men that aren't coming forward. So but coping research is very complex because there's lots of what we call proximal variables and factors. That is, sometimes we don't know whether it's a chicken or egg thing. So, people who have experienced child sexual abuse may have had other trauma in their lives. So sometimes it can be difficult to attribute both coping and effects of abuse specifically to child sexual abuse. It might be also multifaceted aspects of trauma. And there's various theories around this, such as complex trauma, etc. There's very few studies on men and coping. I'm just going to give you a brief overview of this sample. You can probably tell by my accent, hopefully I haven't lost it, that whilst I'm located in the UK, I'm Australian, and the men that participated in the research I'm talking about are Australian. Although I have done some comparison with men from both the UK and North America, and for the most part, many of these things hold true for Western men, predominantly white men. There were 147 men in this study. They all had experienced some contact abuse that involved physical contact. We screened on that basis to ensure that we had some consistency around the type of abuse being reported, and that was not to say that non-contact abuse is more or less traumatic. It was purely trying to make some comparable analysis. And a number of these men we interviewed, and you'll see some quotes a little bit later in the presentation. We did compare the men with a normal community sample, normal in inverted commas, just to see how these men varied, and you'll see that in some of the graphs in a moment. The methodology was about generating both qualitative data, so getting some impressions, and then testing that in surveys, and then flexing out some of the subjective means or lived experience from men through an additional qualitative studies, which helped us shape the implications and some of the things that aren't captured by statistics, or vice versa, the actual important statistics that make a compelling argument for why this is such an important public health issue. I'm going to just go through some of these stats fairly quickly, and then we can, if there's questions, please stop me. But I mean, in essence, this shows that men who were sexually abused had a much higher rate of PTSD than a community sample, around 10 times the rate. Now, I mean, something that I'd like you to think about when you're looking at these statistics, and they're pretty significant in terms of 10 times the rate, and that's taking into account that, some criticisms of this sort of research is that the 147 men might have been self-selected on the basis that they are more severely affected than other men. But 10 times is still a very significant rate that you wouldn't ordinarily expect even with a fairly limited sample. Clinical diagnosis, that is that these men had some type of psychiatric diagnosis that had been formally recognised by the medical system, and this was around 3 times the rate than you'd ordinarily expect in a community sample. I'm going to be using quotes, and this quote comes from one of the men that participated in the study. And I think these quotes really illuminate what some of the statistics don't show, and the ongoing effects. So this man, I'm going to read some of them, some I'll ask you can read. This man says, "It's still lurking, that inside of you, there's still this sort of feeling that, basically something's flawed in me. It happened because I was weak, or I was effeminate, or I was whatever, and I'm different. I don't fit the classic model of masculinity that my brothers fit more easily than me, So this ongoing questioning of self that the effects of abuse have on men can perpetuate other senses of anxiety, depression, and affect other identity issues. And some men spoke about being continually on alert as a result of the abuse, that they felt like they were constantly at a high level of anxiety that meant they had very little moments to feel calm or at ease with themselves. Something really interesting from the effects that I think are very compelling is the suicidal ideation. And there's 2 main points from this, is that many of the men had reported that they had thought about killing themselves at some point in their life. And of these men, 46% had actually made an attempt at some time. The critical aspect here for learning and intervening with men from a practitioner point is that a lot of research associates suicidal behaviour with a mental health diagnosis. And that tends to dismiss a whole substantial number of people who may not have contact with the mental health system. And this is brought out by these results. First of all, I wanted to show that the men who reported a suicide attempt didn't necessarily have a psychiatric diagnosis, so that wasn't a predicting factor. So it has some real implications for men at the front line of professionals who intervene after a suicide attempt to be thinking more broadly than purely a mental health focus, but also that this is a response to trauma